Hello and welcome to Ideagen TV's 17 Days of Sustainability. Today we're honored and thrilled for a fantastic power talk from Kyu Rhee, the Vice President and Chief Health Officer at IBM Corporation and IBM Watson Health. Kyu, how are you?
I'm doing great. Thank you for having me.
Yeah, of course. We are thrilled to have you on the show and a part of this historical Ideagen event. And we know that you have a fantastic presentation ahead of you. So with that, I'll turn it over to you and let you dive right into your power talk.
Thank you so much, and thanks to the organizers. I really appreciate this opportunity to be with you. And as you can see on my first slide, I think we're all adapting to this new normal as it relates to this global pandemic. I'm very proud to be with a company that was actually here in 1918 when there was the last global pandemic that occurred. And I would suggest that we all have a unique opportunity to reflect on this new normal that's evolving. And Brene Brown talks about this as a global vulnerability moment. A chance in which we're all realizing how globally connected we are and how frankly, globally fragile we can be. There's another author, Bruce Feller, talks about life in transitions and how there's a life quake that's happening across the globe, and we're all experiencing it very differently personally. So for me personally, this current pandemic reminds me of very much why I became a doctor, why I went into public health, and why we have this extraordinary opportunity and privilege at IBM to help support so many clients and partners all across the globe. I'm fortunate. My daughters, who are their pictures are behind me, and some of their drawings are behind me. They're in virtual education upstairs now, and they'll eventually go to a hybrid model next month. But I get reminded every day of why I work so hard by seeing them, but also seeing so many of our clients and partners virtually, and looking at ways in which we can support them through this global pandemic. So what I'd like to share first is, as I stated, IBM is about 110 years old, and as we all have our perspectives, and having been the chief health officer at IBM now for almost a decade, I've learned to appreciate the role that data analytics and artificial intelligence and the shared expertise of the cultures of tech and healthcare and public health working together to respond to this crisis. And so at IBM, from Wuhan to Wilmington, we've been working very hard to recognize the challenge that our countries and our globe are facing. And we've looked at efforts and initiatives in these three areas to support. First, I would suggest we started with our own employees and our own workforce across 170 countries, nearly 350,000 employees. And of course, the families and the communities in which they serve, and looking at ways in which we could assure that they're healthy and safe. We have a significant percentage of the workforce that's we would call the traditional essential workforce, who go into a data center, go into a client site every day, and we need to make sure that they're safe and healthy. But for many of us, including myself, who would generally travel quite a bit to meet with clients and partners, I have the good fortune and privilege of working from home. So how do we support this new normal? How do we support the resiliency and the challenges that we face when you now adapt to more of a work from home and this work-life integration, which we typically had talked about work-life balance. And so resiliency and adaptation is core to our mission as we learn to work from home, sell from home, learn from home. As you look across to the middle here, a big part of what we do is make sure we provide trusted information to our clients and partners. And so we were very committed to leveraging some of the capabilities and solutions that IBM has. For example, like the Weather Company. This is an app that is preloaded on Samsung and iPhones. This is an app that's often used as it relates to weather, something people look at every day. And hundreds of millions of people across the globe have access to this tool. And we wanted to add public health information, trusted information from trusted sources like WHO or CDC about the virus, about its symptoms, about its challenges. We added conversational AI to it. And we provided that to the general public so that they can see personalized community-based information. They could see information about the Red Cross and how they could donate blood. They could look at ways in which they could enroll in a clinical trial. And so we're very proud of that being an example. We also have a solution that's providing support to pharmacists, nurses, and doctors all across the globe, Micromedics, and with Dynamed. And we provided that information, that evidence, that knowledge to those clinicians across the globe in the area of infectious disease. As you can imagine, with these symptoms and these conditions, whether you're an ICU doctor or an outpatient doctor or a pharmacist or a nurse, you're very concerned about the impact of this virus and whether or not it's going to impact you or how you're going to treat your patients. So keeping up to date with that evidence, providing the information and the tools to support those clinicians was another area of trusted information that we provided to clients and partners all across the globe. We also leverage, as I was indicating before, conversational AI in over 25 countries to help them, whether it's the Ministry of Health in a country like Poland, or it's a hospital in Atlanta. We've provided this capability so that you can use conversational AI as people are so concerned about their call centers being overwhelmed. And so how could you support through AI the information you need to make important decisions about testing, about symptoms, about COVID? And so we've done that across the globe in 25 countries. In the first area here of accelerating discovery, we've been very committed to ways in which we can leverage the fastest computers in the world that we have, and this idea of leveraging supercomputing power to help support the acceleration of discovery for a vaccine, for repurposing of drugs to defeat the COVID virus. So we've partnered with the White House in the US. We leverage this supercomputing consortium, and we've been supporting a number of researchers, doctors, and scientists who are working to leverage the supercompute power that a company like IBM and other tech companies can provide in this consortium to find new ways and new variants to focus on, or new approaches to building and developing a vaccine. So these are some of the initiatives we immediately enacted as we have reacted to this virus. And once again, speaking to the values of IBM and our role in the community, our former CEO talked about this quite a bit, about our role in society and global society and the value we need to provide in advancing areas like health in that society. As we think about our solutions and we talk about to our clients, and we have a diversity of clients in health in areas of government, life science companies, employers, health plans, and hospitals and health systems. We've been very responsive, I believe, in recognizing how our solutions and our software can and should adapt to this new normal. As I highlighted earlier, the importance of working safe and working smart, and leveraging tools across IBM that have been supporting commercial real estate, that have been supporting manufacturing plants, that have been supporting employers as they try to manage their healthcare spend and costs and improve value to the people that they serve, including reducing gaps in care, whether it's in health disparities or health inequities, and the management of chronic conditions. we've put all these solutions together in an effort called Watson Works, and provided this to many clients and partners to help them in this new normal that's evolving. We've thought about how you can improve the digital experience for customers. As we know now, there's quite a challenge to have the traditional model of selling at sites with COVID. And so you've got to now improve that digital experience, that online experience, to connect with, to retain and acquire customers for your business. The importance of business continuity, as we all know, whether it's as we learn about these cluster events that occur at a company, at an event, at a site, it's so essential that you have these plans in place. We've had pandemic preparedness and response plans in place for our history, but how you support businesses in that effort around business continuity is really important, and how you use technology and services to support that. This movement to the cloud, this recognition that the data is an oil. It is something that is incredibly precious, that every company has access to, every government, every organization, and it is a commodity or an asset of trust. And so how you make sure that you have access to these data sets, and how you leverage the cloud to bridge data sets, how you bridge through a hybrid cloud, how you bridge through an open cloud, is really important. And then making sure it's secure, because once again, going back to the role that you have in trust in customers, as we all know, it takes a long time to earn trust, but it takes a very short time to lose it. And so making sure your data is as secure as possible, and cybersecurity is really important in this age of technology and hacking and data challenges. And then, of course, the supply chain, not only in the traditional areas like personal protective equipment, but we're finding whether it's groceries or drugs or anything that keeps your business moving and provide services to the communities you serve, it's important to have a very thoughtful approach to supply chain, and how can you leverage tools like blockchain to support that effort. So I just want to highlight that prior slide was really about what do we do as a global citizen, and this is really talked about what are we doing as a global partner with many clients, and those diverse types of clients that we have, from governments to life science companies to payers to employers and to hospitals and health systems. So it's fascinating. I think pre-pandemic, whenever you'd reference a curve or flattening the curve, people might have thought of something else, like maybe obesity or some other topic. But I think the whole world has gotten a literacy lesson as it relates to public health and the curve of COVID, whether that curve represents cases, hospitalizations, and unfortunately deaths. And these are curves as it relates to cases of COVID as you look across since the beginning of this crisis and this pandemic. And you've got every country, every region, every county and state looking at their respective curves and trying to consider what impact. And citizens are looking at it. I look at, through the Weather Channel app, I look at the curve in my county. And as I think about, going out for grocery stores or going to take my kids to school, which will happen next month, I'm thinking very proactively about what is the impact on the curve in terms of what we as a community are doing as it relates to non-pharmaceutical interventions. For example, the roles of washing and wearing masks and social distancing. These all have a significant impact, we're learning, on how we control a virus and prevent spread. So I wanted to highlight this, but I wanted to now move and the recognition that COVID has taught us how important my health is connected to your health and vice versa. and it's really our health, or as some people would reference, it is public health. And so taking this thinking that Brene Brown talked about the role of this global vulnerability moment is now a global visibility moment, I wanted to suggest that COVID, the curve of COVID, is making us more and more aware of these other curves that have always existed there and perhaps are becoming more visible in the same way that the infectious disease curve and the role of how we control infections is becoming more and more visible. So we must flatten what I call the 4 curves of COVID. So in partnership with Fortune, we've done an important job of trying to talk about this and share how we believe the health system can and should be reinvented. And part of that paradigm is thinking about these 4 curves. So you've got the infectious disease curve, of course, which is related to COVID, but don't forget other vaccinations. Don't forget, as we're waiting for a COVID vaccine, influenza, pneumovax, childhood vaccinations. Unfortunately, as we look and work with partners and clients, we're seeing that many people are delaying the vaccinations that we know work, that are safe and effective, and that prevent the spread of disease. So as we're looking at the flu season in the Western Hemisphere, it's very important that we are proactive about flattening, other infectious disease curves and vaccinating our children, our adults, our elderly, to assure that curve beyond COVID is being flattened. In addition, I think in this age of social distancing and the challenges as it relates to mental health and mental illness, which has always been there, we are seeing much higher rates of depression and anxiety disorder and symptoms, partly related to the economic challenges and the fear, like 1 in 2 Americans, for example, are losing income since the beginning of this crisis in their family household income. So that can obviously have an impact on your mental health. Your fear of this virus, of course, plays a role. But mental health issues were always there. And while it traditionally takes 11 years to go from having potentially the diagnosable symptoms to actually diagnosis, we really need to address this crisis as a society. We need to address the role of mental health in this age of social distancing and social isolation. And so this is another area I believe we need to address. There was a study done by the CDC that looked at essential workers and those who came to work every day, and saw that 20% of them had thought about suicide in the last 30 days. I mean, just imagine that. If you were to get to that point, and how important it is to be reactive to those types of statistics, but proactive about preventing that from happening. So mental illness is one curve. The other curve are chronic diseases, which you could argue mental illness is also a chronic disease, but it's brought out specifically. You could have acute on chronic, or you could just have an acute episode of mental illness. But chronic diseases, which represent 90% of all healthcare spend, there are big challenges. We're discovering in a number of studies, and once again, as talking to clients and partners, we're seeing that many people are avoiding care. You can't get a mammogram virtually through a telehealth visit. So while there's been a great growth in telehealth, and there's been more progress made in 10 weeks than 10 years in the field of telehealth and telemedicine and virtual medicine, there are many things you cannot do virtually. And so mammograms, pap smears, colonoscopies, these all play an important role in detecting disease like cancer early when it's treatable, not later, ideally when it's metastatic and it's much harder to treat, and your outcomes are much worse and your expenses are much higher. And so a number of studies have shown that the visits that are occurring as it relates to ER visits in terms of heart attacks, diabetic emergencies, strokes have gone down, and people are having these heart attacks and mini strokes and diabetic emergencies at home and waiting till it gets very bad before they call 911 or go see their doctor or go to the hospital. So we've got a big crisis there in chronic disease as well. And I think the role of primary care, I like to say community PPE, the importance of community PPE is the role of public health, primary care, and equity is going to be very important as we think about reinventing our health system. And on that last item of equity, that brings me to the challenges we're seeing across the globe, that in general, the communities of color and poverty are the ones that are suffering the most with this crisis. And once again, this is not saying that it didn't exist before, it did. The issues that are being raised as it relates to poverty and communities of color and racism, those have all been there, but COVID is now accentuating it. It's making it worse, and it's making it more visible with increasing unemployment, increasing lack of insurance, the whole test, track, trace, treat paradigm. While in many parts of the world, there's been some great successes, like in parts of Asia, many parts of the world in the developing world, India, Brazil, Africa, many of the communities in rural communities, urban communities in the US, we've been challenged to make sure we're addressing this epidemic, and disparities or inequities play a very significant role in another curve that needs to be flattened. So our ability as a community, as a globe, to address all four of these curves of COVID is very essential. So how do we do this? How do we approach this opportunity to flatten the four curves of COVID? How do we address this opportunity we have to reimagine our health system and look at the role of technology and this ecosystem of partners? I like the simplicity of what I call the 3D paradigm: determinants, data, and decisions. And so as you reflect on the determinants of health, as a physician, I recognize, those valuable visits with a family, with a child, with an adult, with a grandparent. And as I reflect on those types of unique privileges and opportunities in an exam room, you recognize that so much of health goes beyond that exam room. We each have 8,760 hours a year. And typically, most people spend only an hour or two in a doctor's office, in a clinical setting. And so health occurs outside of that community within a hospital or a clinic. And so you need to think about the determinants. And the way I like to simplify it is 1, 2, 3, 4, which adds up to 10. 10% of determinants are typically healthcare related. 20% are typically genetics, and it's connected to family history. 30% is social and environmental, and 40% is behavioral. And all of these determinants play a role, and they overlap. Clearly, if you have genetics and family history, your behaviors are often influenced in the community and the family you live in. So there are overlaps. So these are not necessarily silos. But we have to recognize that so much of the determinants of health are related to this interconnectedness of different, now the next D, data sets that you have on these determinants. You need to be thinking about how you link these data sets together, how you, in some ways, instrument the data, how you interconnect the data, and how you then make it intelligent. Because you can't just give people kind of a bunch of data. You need to have analytics and potentially more traditional and non-traditional methodologies of analysis, like machine learning or artificial intelligence, to make insights out of that data, to bring the determinants in the data to those decision makers, to those government policymakers, to the life science companies that are building vaccines or drugs to treat the pandemic, to those hospitals and health systems, to that ICU doctor in Lagos, Nigeria, who's never taken care of COVID before and is now faced with the first case, to that payer, that employer or that health plan who's looking to manage the health of that population, whether they be in a state or in a whole nation or globally, as many payers are global. Like IBM, we think of ourselves as a payer. How do we keep our 350,000 people our workforce safe and healthy across 170 countries. And so that idea of making sure you think about the determinants, the unique data sets you have, the ability to connect those data sets, to translate it into insights through analytics and AI, and then to help those decision makers to give the right information at the right time in the right part of the workflow to make the right decision is essential, is really important. So that when you have that encounter, whether you have it here like with a doctor and a child, you're making that better decision. And one of the value props we always talk about at IBM is this is not about replacing that human expertise or that relationship that's so essential to what health and healthcare is about. It's about augmenting that relationship. It's about supporting that clinician to do what he or she does best about that relationship-based care, and letting the computers and the technology to do what it does best, bringing unique data sets or insights to that clinician, to that shared decision-making process to make the best decision for that child, for that family, and for that community. So those are the 3Ds. As we think about this evolution and the role of technology, I just want to highlight what I call the need to lead with science, but also to leverage technology from benchside to bedside to curbside. And so as I reflect on the work we are doing and we must do in this pandemic, but in general for health more broadly, it's important that we are thinking about leading with science and technology across from the microscope to the community. So IBM has had a long-standing commitment to science. We're very proud. This is the headquarters of IBM Research, where we've been leading in patents for over 27 years. And we are very committed to this commitment to science. And the nature of science is very powerful. There's a commitment to transparency, which I think is so essential to trust. You need to show that how your technology works and publish it in the peer-reviewed literature so people can see those results and recognize the areas it can help and potentially areas where we don't know if it can help. And so this commitment to science is core to our values, and it's core to what it means to be an IBMer. So as you think about the science, I'm just going to share a few examples. There are hundreds and thousands of examples of what I would call scientific studies and results that we've presented through a peer review process at conferences, at meetings, in journals. But this is just one example with COVID. Fairly quickly we looked, and once again, benchside research looked at the variants of COVID and looked at the different strains. Many people know, for example, in the US, there was a European strain that affected the East Coast, and there was an Asian strain that affected the West Coast. And so as these variants evolve, it's so important that we track that benchside research to support scientists in their drive to find vaccine and to recognize the science of this virus, in terms of length of immunity, the impact of different treatment options. And so this is one example of an IBM research study where we did in partnership with an academic institution in Japan. And so many examples of this in what I would call benchside research. We've also got many examples of bedside, which is the concept of a clinician, like I think about it in terms of a doctor and a patient. And this is just one region in the Middle East. We've done a lot of work as it relates to in Dubai and Saudi Arabia and UAE. I mean, there's been quite a bit of attention about the peace process in that part of the world and how we've helped hospitals and health systems and public health departments in those areas transform their IT systems, their EMR systems, integrate those data sets that I was referencing before, improving customer satisfaction, whether it's the customers of the clinicians or it's the patients, looking at measures of improving things like vaccination rates or reducing high-risk pregnancy, giving access to virtual assistants with AI, helping these hospitals become cognitive hospitals, where they're leveraging the best of technology to let those clinicians do what they do best in those relationships with patients and the community, and let the technology do what it does best in terms of bringing insights out of that data and making sure that data is secure and connected. So these are all some examples there. And this is just one region. And what I love about IBM, many things I love, is just the I stands for international. And you learn so much about health across the globe as you support diverse clients across the globe. And you learn that health is so essential. It's so common. We all care about it. And we're all committed to finding ways to address it. Sometimes we lose sight of how important it is until we have a pandemic, or until we're sick or ill or have a loved one who's in the hospital. So I think there's an important role that data analytics and AI have in predicting disease, predicting a pandemic spread, and preventing those consequences, that disease, the consequences of the disease or a pandemic spread. The last one here is as we think in terms of bedside to curbside, is the role of population health. And this is, once again, the I in IBM standing for international. It's amazing to see examples like what we're doing in Scotland, in NHS Scotland, and helping the government of Scotland address benefits beyond the traditional healthcare benefits, especially for those vulnerable families, in terms of benefits they need to help have a healthy start. Many of these families were first-time parents, for example, and looking at ways in which you can support the different benefits that were in the Social Security Scotland system and bringing those benefits quickly to those citizens in a simple way, in an efficient way, in a scalable way, in a secure platform. And so, being able to scale that quickly and provide those benefits and play a role in having that technology support, those 14 benefits for 1.4 million people is a great opportunity and a great privilege for us as we think about the role of technology. So, look, I've been talking. We've had this movement, particularly in the U.S., and a discussion about volume to value, and value-based care is this idea that quality over costs. Our goal is, how do we challenge the system to provide higher quality at lower cost? How do we reduce the waste in our healthcare and our public health system? But I think with COVID and this lifequake that's impacting all of us, this global vulnerability moment, this global visibility moment, and as we think about those four curves that have always been there but are now more visible than ever, it's important for us to go from volume to value to values. The system as we know it is being reinvented. Business models are being challenged. The future of health and work is going to be different 2 years from now than it was 2 years ago. And so the question we all have to answer as we think about this goal of good health and well-being is, what are our values as a society? And how is COVID going to challenge this? There's so many challenges as you see on the right in terms of the impact of the pandemic, in terms of the impact on vaccinations, the disruptions, the reversal of decades of improvement. The concern I have as I think about the global population and how so many health disparity populations are being impacted in ways that are really catastrophic. But we have an opportunity, those of us, each as citizens, as members of our companies, our organizations, our governments, our employers, we all have an opportunity to highlight, what are our values? Do we value science, the role of science? I'm very concerned about what will happen with vaccinations. Vaccines are safe and effective. We have to make sure this next vaccine for COVID is safe and effective before we use it, before we implement it globally. But I mean, vaccines have had a long history of bringing incredible value across the globe. And so, climate change, for example, as you think about environmental health, where are we on that? When it comes to the 3 W's of washing, watching, distancing, mask wearing a mask, where are we in that as a society? So I believe strongly in science-based, data-driven approaches as a value. As we think about mental health and mental illness and changing this 11-year cycle of symptoms of a disease to diagnosis of disease, we have to get that to 11 days. We've got to change that. We've got to change the paradigm of treating illness and preventing it and promoting resiliency. As you think about chronic diseases and the incredible impact this has on economies, 90% of healthcare spend, and that spend keeps going up. How are we going to not only prevent the consequences of those chronic diseases, but prevent those diseases? Do we value prevention? As we think about inequities and these disparities that exist across the globe, and that, that these injustices that we're witnessing, how are we going to address those and promote equity and make sure that everyone, every child, every family has that opportunity to live a full, fulfilling life for their family and their community? And I think inequities are a big threat to that. So do we value equity? The role of family, I think we live in a new normal where there's a different social contract, whether it's government and citizen, employer and employee, life science companies who have traditionally had challenges in recruitment for certain groups like minorities in clinical trials. There's a very different paradigm that's evolving. And I think this crisis is reminding us about the importance of family and the importance of community. And how are we going to assure that the work we do now for my kids, for your kids, for future generations, fits and values the role of family and community? So I like to say, let's deliver values-based care and a values-based system. So on that note, thank you for indulging me and giving me an opportunity to be in your homes, in your communities, and share some of my thoughts about what we can do together. Thank you very much.